Thank you, Mr. Chair and members. The spreadsheet in front of you shows both the House and the Senate versions of the bill, along with the current law spending that exists for the reinsurance program. The current law spending is merely shown as a comparison and to illustrate how the carry forward in the premium security plan account works. The meat of what we are going to focus on are on the sets of columns labeled Senate File 3472. You'll notice that this runs through fiscal year 28. The state's fiscal horizon ends after fiscal year 25. So this might look a bit unusual compared to what you're used to seeing. The reason for that is that with a 5-year extension of reinsurance, the estimates that were used to put together the Senate's bill looked at the totality of those 5 years, not just through the end of fiscal year 25. So just going down through the lines, I will walk through the Senate version of the bill, and then I will let Mr. Harney do the same for the House's bill. But just going down through the lines, the first rows through lines 2 through 5 show the revenue that would be deposited into the premium security plan account that is used to pay for reinsurance claims. Line 2 is the balance forward. That's the amount that would carry forward from the previous year and be available to spend in subsequent years. Line 3 is federal revenue that would be estimated to be deposited into the account. These amounts were identified in a fiscal note. Line 4 is interest income. That is not assumed for anything other than what's currently in law. And line 5 shows a transfer from the general fund. And in the Senate bill, this is a $1.087 billion transfer. And if I could skip down to line 16 real quick, this illustrates how that number was calculated. It is the amount that would be necessary to pay for all reinsurance claims and Minnesota Comprehensive Health Association administrative costs through fiscal year 28 and result in having a $0 balance in the premium security plan account. Basically, it's the amount that's needed to pay for 5 years of reinsurance as currently estimated. Jumping back up to line 9, this is this shows the value of the estimated reinsurance payments. Again, these were identified in a fiscal note, and you can see that it shows increasing payments for each year due to increased enrollment and the effects of the rates. On line 10 is a line for the Minnesota Comprehensive Health Association's administrative costs. And on line 13 is a transfer to the Healthcare Access Fund. Currently, there is going to be a transfer to the Healthcare Access Fund at the end of fiscal year 24. It's not in the forecast, but the estimated balance of the premium security plan account at the end of fiscal year 24 will be about $79.5 million. You can see that transfer goes away in the Senate's version of the bill because rather than making that transfer in fiscal year 24, the Senate bill delays it for another 5 years. And because the amount, there won't be an estimated balance in the premium security plan account at the end of those 5 years, there will not be any amount left to transfer. There are some other expenditures in the bill that are directly appropriated. On line 20, there are appropriations for MNsure, and these are to offset reduced revenue that was identified in the fiscal note. So it's roughly $4.5 million per year. The fiscal year 23 and 28 amounts are slightly less because of the way that the calendar year operation of MNsure aligns with the state's fiscal years, which start on July 1st. And on line 24, there is a 16A 724 transfer reduction. This is due to a provision in 16A 724 that transfers transfers $122 million from the Healthcare Access Fund to the general fund, or less if $122 million does not exist in the Healthcare Access Fund. And the reason it is shown as a cost here is because on line 31, the Senate bill appropriates money from the Healthcare Access Fund to Minnesota Care. And this is again to compensate for reduced revenue that would result from extending the reinsurance program for another 5 years. Because of those appropriations, the Minnesota or the Healthcare Access Fund would not have sufficient resources to make the full $122 million transfer in fiscal year 25. The difference between the amount that would be transferred and $122 million is that $26.68 million shown on line 24. So that is counted as a cost to the general fund of the Senate's proposal. And just to round this out, on line 32 is the cumulative total of the Healthcare Access Fund appropriations for Minnesota Care. It's about $287.349 million. These appropriations do not go on past fiscal year 25 because the fiscal note did not identify costs. As I mentioned before, that's kind of the end of where the state budget planning takes place. And so we don't know those amounts for fiscal year 26 and 28. And that's, Mr. Chair, that's all I have for the Senate's side of the bill.
Chair Dames, Chair Stevenson, Joe Harney, House Fiscal. Lines 1 through 16 on the House position relate to the impact on the premium security plan if there is federal approval of the continuation of the state innovation waiver and if there's no further legislative action funding the premium security plan account for any amount of time within the years listed. Since the House position in the bill is that the continuation and the funding of the PSPA is contingent on that approval and does not address it, I will direct members then to lines 18 through 25, which discuss the appropriations that remain in the bill there. Line 21 is a mental health parity and substance abuse office at the Department of Commerce. This office would receive a base appropriation of $500,000 a year. Line 22 reflects Section 11 and Section 12 of the House bill. This is two studies. One is a delivery reform analysis report, and the second is a proposal for the public option. The $3,929,000 here reflects the cost reflected in the fiscal note to DHS for the combined effort for both the reports. Lastly, on line 23, the transfer from the general fund to the Healthcare Access Fund here is $110,674,000. This transfer comes from M&B to the Healthcare Access Fund, and it's for costs related to the loss to federal revenue associated with the extension of the premium security plan account to Minnesota Care through plan year 2023. This, two things to highlight in these lines here. The public option development and delivery analysis. This is a intended to be a one-time appropriation. A technical drafting error exists where it could be assumed that it is ongoing. That is one time. And lastly, the transfer is not appropriated in the House bill to the Commissioner of Human Services. So in order for the Commissioner of Human Services to have the authority to spend that money, language would need to exist that simply appropriates it for that purpose. With that, Chair Dames, Chair Stevenson, that concludes the House presentation of the spreadsheet.
Members, any questions for the fiscal analyst? Representative Schultz?
Thank you, Chair Dames. I have a question. Why don't we forecast beyond 2025? Because the costs don't magically go away. How are we going to pay for Minnesota Care and MA? So can we
If one of
forecast?
you would answer that?
Mr. Chair, Representative Schultz, I don't want to be too philosophical, but I think the rationale for having a finite end to the state's budgeting horizon is that beyond a certain point of time, uncertainty exists and the accuracy of estimates declines. That's admittedly something that we are not doing when we're looking beyond fiscal year 25, but with Minnesota Care specifically, the fiscal note did not identify any costs that were present beyond fiscal year 25.
Follow-up?
But obviously, there would be if we took that to zero, and we currently use it to fund Minnesota Care and Medicaid. So no further question, but I think that's a big concern for me.
Thank you. Chair Stevenson?
Thank you, Mr. Chair. And I think that's a good point that Representative Schultz raised. And I just want to ask, or I don't know if this is more of a comment than a question, but on both sides of the spreadsheet, we have costs on line 2 and line 9 that are made out of the premium security account for those years that we're not forecasting. So we seem to be forecasting what will happen with the premium security account in the out years, but not in the healthcare access fund in the out years. And that does seem to be odd that we would do one and not the other. How is it that we're able to forecast what claims will be in the reinsurance arena on the premium security account, but not what costs will be in the healthcare access fund?
Chair Stevenson, the fiscal note reflects the estimate of reinsurance through the seeking of the waiver of 5 years. So Commerce and the respondents on the fiscal note made an effort to estimate that cost as it ties out to the bill as drafted, whereas the Minnesota Care funding, again, is sort of tethered to the existing fundamental forecast the state provides.
Follow-up?
Well, thank you, Mr. Chair. And just a comment, I would say that my view is that the cost of reinsurance includes not just the amount of money that we have to put into the premium security account that goes out, but also the impact it has on other parts of our government. And that's the position that the House took on its side. And I think actually the Senate is taking a similar position in their view. We just didn't forecast it out on the spreadsheet beyond those first 3 years. And I think we should be thinking about to the effect that we're going to have reinsurance beyond the forecasted years. It's not that the cost to the BHP goes away, it's that we haven't put it on the spreadsheet. And that's pretty important. We're still going to accrue those costs unless, and hopefully, the federal government fixes and adopts the second half of the waiver by rule, or perhaps there's some congressional action. But those costs don't go away unless we either pay for them or the federal government changes the law.
Representative Liebling? I believe you had a question. Oh, okay, I'm sorry. Any other questions? Representative Schultz?
So in the Senate bill, thank you, Chair Dames. In the Senate version of this reinsurance legislation, why is there a transfer of money from the Healthcare Access Fund? That's already current law for the BHP impacts. What we really need is a transfer of money into the Healthcare Access Fund, as the House position takes, though only for 1 year. Rather, we shouldn't be taking money out of the Healthcare Access Fund. So can you comment on that?
Casey?
Mr. Chair and Representative Schultz, I don't have the Healthcare Access Fund statement in front of me, but I'm recalling that the balance would have been sufficient to pay for these appropriations in the Senate bill through fiscal year '25 without putting additional money into the fund. Whether additional funds would be needed beyond that is not known because the fiscal horizon ends at fiscal year '25. But without having the fund balance in front of me, I can't give you specific numbers, I'm afraid.
Follow up?
Representative Schultz.
Thank you, Chair Dames. So we're going to face a huge cliff if we're not good at our budgeting. And I would like to hear from my Republican colleagues about their ideas for what happens when we hit that, when there's no money to pay for our essential programs for people who need health care.
Senator Draheim.
Thank you. You know, I think it was stated earlier that, you know, we're waiting on the federal government. And there are things that I think a lot of us expected 5 years ago that didn't happen. And this is the best option that I have seen or been proposed to stop the double-digit increase in health insurance cost in my area, the rural areas especially. Imperfect. I don't care for the concept, but I support the bill 100% because it's our only option. Yes, we'll face some fiscal concerns no matter what we do. But I think this is a proven plan that helps reduce the cost for health insurance, especially in the poor rural areas. So, thank you.
Representative Schultz.
Thank you, Chair Ames and Senator Draheim. I know that we share a common interest in addressing the growth of healthcare costs, and I really appreciate the work we've done together in the past. I am concerned about the growth in healthcare costs and have stated on the House floor many times on Thursday that reinsurance really does nothing to address costs. It may lower the premium. We don't know how much. We don't have a guarantee from the health plans how much lower the premium would be, but it does nothing to address the large deductible or the cost sharing. So consumers, constituents of yours in rural areas all over the state, rural, urban, metro, are going to be at risk with that the high deductibles and cost sharing. So I really urge us to really think carefully. There are other options out there. I have a bill, House File 11, that has a solution for the bridge to nowhere. It's a bridge to somewhere, and that's the public option. And that just allows people to buy into the Minnesota Care program, something that the Senate passed last year. That was fixing the family glitch. So employees who have affordable health care coverage can buy into the Minnesota Care program. That is the public option that I think a lot of the Republicans in the Senate and the Democrats supported. So we do have a solution. It does have bipartisan support, and we should think about that as a solution and have reinsurance only be temporary to get to that solution.
Members, other questions on the fiscal? Seeing none, thank you, folks. Next, if we could have the council folks go through the policy part of it.
Chair and members, this is Laurie Pompu in House Research. And I see Chris Stang is joining us at the table.
Yep. Welcome to the committee, young lady.
Hello. Chair members, I'm going to go through the side-by-side. Much of it is House-only language, and so I'll be doing the majority of the time. Beginning on page R1, Section 1, House-only language. This section changes the number of members and qualifications for membership on the Minnesota Comprehensive Health Association Board. The board operates the Premium Security Program. There's a repealer at the very end of the bill, which this language is replacing the current statute. Section 2 The House and Senate language match. The language is the same. It extends the premium security program to encompass years 2023 to 2027. There is a difference in that the House language has a contingent effective date, making the section contingent on federal approval of the continuation of the state innovation waiver. On to section 3, House only language. Currently, the law requires health carriers that are offering a catastrophic or bronze health plan in a specific service area for individuals have to also offer a silver and a gold level metal plan. The change in this statute requires them to then also offer a platinum level health plan in that same service area. This section is effective January 1st, 2023. Section 4, House only language. This section makes changes to the private health insurance statutes. It requires health carriers to cover comprehensive postnatal visits at 3 and 12 weeks post-delivery. It also requires coverage for any provider-recommended visits in between those 2 points in time. The section is effective January 1st, 2020. Section 5, House only language. This section requires health carriers who offer individual or small group health plans to include a pre-deductible, flat dollar, copay amount prescription drug benefit in at least 25% of their health plans. This section is effective January 1st, 2024. Section 6, House only language. This is a cross-reference requiring medical assistance to cover the postnatal health care that I discussed under Section 4. This is effective January 1st, 2023. Section 7, House only language. This section requires Minnesota Care to have an actuarial value to benefit ratio of no less than 94%. This section is effective January 1st, 2023. And then on to Section 8, we have House and Senate language that match. It changes the date by which funds remaining in the premium security plan account have to be deposited in the Healthcare Access Fund. Currently, these are to be deposited June 30th, 2024. This section pushes it out to June 30th, 2029. Again, the difference between the two sections is that the House language includes a contingent effective date based on the approval of the continuation of the state innovation waiver. On to Section 9. This again is the same in the House and the Senate. It sets dates by which proposed rate filings for individual health plans have to be filed with the Department of Commerce. It adjusts the dates, assuming that the reinsurance program will operate in plan year 2023. Again, the House language has that contingent effective date. Section 10, House only language. This section creates an Office of Mental Health Parity and Substance Abuse Accountability within the Department of Commerce, which was mentioned in the fiscal presentation. The office will oversee compliance reviews of health plans. It will handle complaints and serve as a resource for health plans on this topic. Section 11, House only language. Delivery and Reform Analysis Report. This section requires the Commissioner of Human Services to draft a report for the legislature regarding service delivery for medical assistance and Minnesota Care enrollees. It lists requirements regarding the goals of the models and what the report itself must include. Section 12, House only language, proposal for public auction. This section requires the Commissioner of Human Services to develop a proposal for a public health coverage option and list goals of the public option. It will provide benefits for and its goals. On R8, we have Senate appropriation and House appropriations, which differ and were discussed in the fiscal analysis. On page R9, we have the Senate transfer and the House transfer, which were discussed in the fiscal analysis. And we have the House repealer, which relates to the composition of the Minnesota Comprehensive Health Association Board that I discussed as section 1.
Chris, would you like, do you have any comments you'd like to make?
Mr. Chairman, members, Lori did a great job.
Members, any questions for Lori or Chris on the policy? Well, seeing none, we've got through both the spreadsheet and the policy sheet, and that's what we are looking at accomplishing tonight. Tomorrow, Zach will have the gavel, and Zach and I will be meeting some tomorrow, probably yet tonight, and talk a little more about this, but if there are any questions procedure-wise, certainly feel free to ask them, otherwise we'll conclude our business for the evening. Zach, would you like to make any comments?
No, Mr. Chair, thank you. I think that you stated exactly how you and I have discussed handling things going forward, and we'll be in touch with members as soon as we have something scheduled.
Good. Thank you, members, and we will now adjourn the meeting of the conference committee for Senate File